We already do have a population of children that are obese and that are going to develop the diseases that we don't want them to have by the time they're 25.
Childhood obesity is a complex disease. In general, it is assumed to be the result of an increase in caloric and fat intake. On the other hand, there is supporting evidence that excessive sugar intake by soft drink, increased portion size, and steady decline in physical activity have been playing major roles in the rising rates of childhood obesity. Researchers say susceptibility genes and environmental factors interact to cause predisposition of childhood obesity. It was also found by scientists that unhealthy eating patterns and dietary habits formed during childhood contribute to childhood obesity, especially if there are susceptibility genes. GBN's Doctor On-Call facilitator, Dr. Sonia Nixon, specified the dietary factors that can predispose a child to obesity.
You don't want a child to become accustomed to high salty food.
Right.
Because it's setting them up, okay? You don't want your child, we don't want to be giving our children sugar-sweetened beverages. Yet they're providing juices that we buy and give our children that are very, very high in sugar, right? That predispose our children to death and obesity.
Dietary intervention studies have suggested that a multi-level approach that focuses on diet is essential in the control and the prevention of childhood obesity. Thus, many researchers agree that prevention is the key strategy for controlling this current problem. Here is Dr. Nixon with an elucidation of the dietary preventative measures.
Breastfeeding is known to be one of the single most important tools in preventing obesity as children grow.
Individual, familial, social, and political level involvement are also recommended for effective and sustainable nutritional management of childhood obesity. A We Culture viewer highlighted the role that various stakeholders play in the prevention of childhood obesity.
All the rubbish that the supermarkets are selling to harm our children, I'm asking the parents to leave it in the supermarket.
Thank you, sir.
And I agree with the doctor in what she is saying. And this should be done on a government level as a policy.
Experts say the most promising approaches for childhood obesity management are intervening with support at levels ranging from the individual to the community. Krista Campbell, GBN News.